Welcome back to KSLA News 12 now at 4. Thanks so much for staying with us. In today's Mind Matters, we are continuing a discussion that we started yesterday. Now, in that segment, we discussed what nursing homes do when they have patients who are agitated or sometimes disruptive. Well, today we want to focus on what families can do if a nursing home sends their elderly loved one to Brentwood. So rejoining us again today, Dr. Catherine Kennedy, a psychiatrist at Brentwood Hospital in Shreveport. So thank you so much for joining us again today and talking a little bit about some things that people are concerned about when they admit their loved ones to a nursing home. You know, there's a lot that goes into making that decision as a family, and families can be very stressed, and families are usually consulted before the nursing home makes a decision to reach out to Brentwood, correct?
That is correct. They will check with the family. If the patient, for some reason, is unable to give consent themselves, they definitely reach out to the family and like to have the family in agreement prior to having them admitted to Brentwood.
And one thing we mentioned previously, when a patient is admitted to Brentwood, there's a lot of discussion on treatment, on how to best treat the patient and meet their needs. Is that discussion included with the family? Is the family aware of what treatment would be advised for the patient?
Yes, we always reach out to the family. Our caseworker will reach out to the family usually within 24 hours. She will let them know that we're going to do a complete assessment and evaluation. And if some families like to be more involved than others with the exact treatment, e.g. medications that the patients will be given. There's some that are very involved. And if that's what they choose to be, we stay in touch with them and get their permission on all that treatment.
Okay, that's wonderful. So there's typically an option for anyone wherever they're being met at.
We have not had the situation where we could not find someone a safe placement.
That is great news, because that's what everybody wants to make sure, is that their loved one is in a safe space, that they have an option to be cared for in a safe and healthy manner.
If by chance that does happen and they do have to go back home, there's a lot of services we can set them up with. There's multiple services we can set them up with that they will have to assist them at home caring for their relatives.
Okay, fantastic. Now, what if there is a moment where the patient is going to have to stay at Brentwood indefinitely? Where do you go from there?
Well, it's an acute psychiatric hospital, so it's usually a short-term stay. It would be very unusual for us to have someone that we cannot get the symptoms under control. Some people, sometimes they're a little bit longer. I've had people it took up to 30 days, but I've not had anyone, and I've been there 10 years, and I've been practicing medicine for 30, that we were not able to get stable and placed back in whatever environment that they needed to be in.
Well, Dr. Kennedy, as we wrap up, any advice for families that are going through the situation with their own loved ones?
Well, what I'd like to tell people is that there is help. There's nursing homes that are very well equipped to handle these patients. There's already procedures and people in place to help if it gets beyond the means that they can manage. And often what you see in the older adults, and what we see a lot of, is people with dementia that develop behavioral problems. Well, that's what we're there for, and we're committed and feel honored to treat this population and be able to help them in the later stages of life. So Brentwood's just a phone call away. The lines are open 24/7. We have a doctor available on call 24/7. If someone needs to be admitted and they're not willing themselves to sign in, that we can get them placed in the hospital. So we're there to help.
Well, Dr. Kennedy, thank you for your help, and thank you for giving us your time today.
Well, thank you.
All right, everyone, we know that there's someone out there watching today who really needed this information, so we hope that you learned something from it. Thanks for joining us.